We're here today at the American Heart Association's Go Red for Women luncheon event. It's an event we hold annually to help raise awareness about the risks associated with heart disease. That heart disease is the #1 health risk for women in the United States. More women of all ages die from heart disease every year than from all cancers combined, including breast cancer. So it's really important that we raise the awareness about the risks associated with heart disease and what we can do to mitigate those risks. Now, there are some risks that you can't really do much about. Your genetics, your family history, your age. We don't have a lot of control over that. But there are a number of other serious and important risk factors that we do have control over. In fact, a lot of control. But it's important first to know your numbers. We have a number of our associates here from BJC that are helping people understand what their health risk status are by identifying the blood pressure, cholesterol, blood sugar, and body weight of these individuals. These are the kinds of risk factors we have some control over, the things that we do every day. For example, smoking. If you don't smoke, please don't start. If you do smoke, I'd encourage you to work with your doctor, your nurse practitioner, your healthcare provider to develop a plan to help you stop smoking. Something else we do every day, we eat and we drink. The things we put into our bodies has a great influence on these very important health status numbers: blood pressure, cholesterol, blood sugar, and our weight. These are things we do have control over. It's important to avoid overly processed foods, saturated fats, corn syrup, fast foods, salt. Importantly, these have a direct impact on those important health status numbers. Another thing that's very important is physical activity. We decide this every day too. For most of us, getting enough physical activity, say about 30 minutes of physical activity on most days that gets your heart rate up, is what we should aim for. Again, I would encourage you to work with your healthcare professional to determine the level of physical activity that's right for you. So these things that we do every day: decide to smoke, what we eat and drink, how much physical activity we get. These are things that can mitigate the very serious risk factors associated with heart disease. Heart disease being the #1 killer of women in the United States. So please spread the word, help save lives. Thank you, and be well.